Well, then, as the country celebrates Heritage Day, public health experts have advised many South Africans and, in fact, made an appeal that those of us who are celebrating do so within the confines of COVID-19 restrictions in order to avoid an increase in the post-holiday era in the number of cases. We know that vaccinations are continuing across the country, but majority of the population has still not been vaccinated. Let's talk about this then with Dr Mvuyisi Mzukwa. He's with the SA Medical Association, where he's the deputy chair, I believe. Doctor, a very good afternoon to you. Grateful for your time. So how worried are you that we may see a spike in infections after this long weekend?
Good evening, Tembegile and to your viewers. I think you just have to think about, the environment in which this is possible. If you look, for example, for the virus to spread, you need a large gathering. The people must be staffed in one place, which is poorly ventilated, and they must not wear masks. The virus then will spread easily. But if you are in a place where there's good ventilation, it's outdoors, and people are obviously maintaining social distance, so you have little chances of the virus spreading, to other people. So we are worried because there are provinces still with very high numbers. Like, for example, in KwaZulu-Natal, we still have a high number of active cases there. So if people are not careful in terms of, maintaining these non-pharmaceutical interventions, then we might see a wildfire getting kindled again.
And what you are competing with, I suppose, this week from a public health perspective is the human urge. People have been locked up in their homes for more than a year. Many are going to see family and friends for the first time in months. And the most natural thing will be to want to sort of throw caution to the wind and take off masks and hug. How do you appeal to them when you're competing with what is a very natural instinct?
I think we all have now lost loved ones. I'm sure all South Africans have people who have, they know of someone who died either in the family or as a colleague or as a friend, people that you are very close to. So I think it's, as you said, it's natural for us to want to see our family members, our loved ones. But we do need to be mindful of the fact that we might be carrying a virus. Because remember, some of us, when we're going around, we are asymptomatic. There are no symptoms at all. So if you go to a place where there are other people, there are old kulus there who might be affected or infected by the virus. So you do need to think about people who are at risk. And those people are people who are above 60 and, people who are having underlying medical conditions. So it's very important to, not to think about yourself, but think about people who are at risk of COVID-19, who might need to be hospitalized or even die for that matter. So very important that we are mindful of those things.
It'll be December soon. Many more people will then head out and travel and visit the country's beaches. Many will want to go clubbing and the rest of it. Is it time to start planning for vaccinations to take place at beaches and perhaps even clubbing districts?
I think we need to go where the people are. Like I said in one of the interviews, the mistake that we've made was to wait for people to come to the vaccination sites and stuff like that. But I do think that people need to, government need to go to where people are so that, it's easier, it's convenient, people can just easily get the vaccine, because it's not all hesitancy. I've always said that government on its side have been hesitant as well. So if we do get an opportunity where people, we know we can get a sizable number of people there, I think we do need to go there and make those vaccines available. Whether we use mobile clinics, whatever we do, but let's do our best to reach out to the people.
Do you think we'll reach 70% of the adult population being vaccinated by December?
Well, I don't think we are going to get there. I mean, it's an ambitious target, but looking at how things are, and people are not willing at the moment for some reason. I cannot blame them maybe it's because there's not enough health education out there. You know, I do think that we need to do more in terms of motivating, you know, people to go out and get the vaccines. Because if vaccines are there and there are no people, then we need to get ways of getting those people to get a vaccine. I do think that we need to talk to South Africans, explain the vaccination. We do need to explain the side effects as well, you know, allay the fears, and people would go for vaccinations.
Dr. Mzukwa, always great to speak to you. Enjoy the rest of your Heritage Day. Thank you very much.
Welcome, sir. Thank you.